I'm Dr. Manuel Astruc. I'm a board-certified psychiatrist. I help entrepreneurs who are suffering from depression get back to being energetic, productive, and very confident. Let me talk a little bit more about medications and give you some ideas of what I'm thinking about when I'm starting to treat someone with medications. The truth is that when we start an antidepressant, not everybody is going to get better from an antidepressant, right? With any treatment modality, there's an effectiveness and there's a percentage that we look at with how many people are going to respond to the medication that they're given. And the range for someone who started on their first antidepressant is somewhere in the 60%, 65% range of response to the first time someone is given an antidepressant for depression. So that's pretty good, but it's clearly not anywhere close to 100. So if you don't respond to your first antidepressant, what happens next? What happens next is that we start to switch and add a different antidepressant. And every time that we add the next antidepressant, if you fail to respond to the current treatment, that response rate actually goes down. So we get 60% response rate for the first antidepressant. The next antidepressant that someone tries, the response rate is not going to be 60%. You know, those folks who have not responded to that 40%, you know, we're going to pick up an additional, let's say 15 to 20% of those are going to respond. And then we try a third antidepressant, lower and lower chances of response. So as we go through switching strategies, chances of getting someone into remission are going down. And these are the patients that are commonly coming to me for treatment. And what ends up happening is that I have to use a lot of different medications. So we augment the three things that we have available to us: changing doses, swapping something out, or adding something for depression. What we end up doing oftentimes, you know, once doses have been optimized and someone's tried a handful of different medications singly, is to start to add augmenting agents. One of the difficulties with this is that antidepressants by themselves have a series of side effects that can be difficult to tolerate. And we're adding other medications that have their own potential side effects. So I'm pretty good as a psychiatrist in helping people to get back to their baseline. But there's almost always a cost in terms of the side effect burden that I've been putting on patients. So transcranial magnetic stimulation is another modality that's available to us to treat depression. It's been FDA approved for treatment-resistant depression, which they define as failing one antidepressant, for the last 10 years. And what it involves is putting a magnet very close to your head, a strong magnet like in an MRI, and delivering magnetic pulses that turn into electrical pulses inside your head, inside your brain. These pulses can be delivered for short bursts, and there's a rest period, and then another short burst. There's about a 30-minute treatment session that occurs when you're getting TMS, and you're going to your TMS treatment sessions for 5 days a week. 4 to 6 weeks generally is what we are thinking about. But what's interesting about TMS is that it's been studied for a lot of patients who have failed to respond to medications. And in that group of patients who have failed to respond to medications, and adding medications just doesn't seem to be that helpful, TMS can still get a 50 to 70% response rate. One of the frustrations for me with TMS is that insurance companies have regulations around when you can use it. So each individual insurance company gets to pick what treatments they allow as what they call first tier, which you can get without any permission. So most antidepressants we can get approved pretty easily without doing any work. We just prescribe a medication. Then there's second tier or third tier or fourth tier treatments. And as we go deeper into what the insurance companies will allow, the insurance companies want you to have jump through some hoops to say, okay, we're going to approve this because you failed, another medication. For TMS, the going regulations from insurance companies are that you have to fail 4 antidepressants and 1 or 2 courses of psychotherapy, depending on the particular insurance company. So what that means is that we're looking often at years of ineffective treatment where someone's suffering from depression and they still are not able to get to TMS if the insurance is going to be paying for it, until you can tell the insurance company, I've tried at least 4 medications and I've tried 1 or 2 cycles of psychotherapy, and I have a patient who has not responded and is suffering. And given that information, the insurance companies will allow us then to proceed with TMS for treatment. And again, in that patient population, we're showing results of 50 to 70% improvement rates. What I'd like to propose is for people who are out there who are earlier on in their course of depression, so mild, moderate depressions, no antidepressants that have been tried, or first antidepressant that's been tried and hasn't worked, that we start to consider TMS as a modality that we can use much earlier in treatment. Now, here's the thing. Insurance companies are not going to pay for that. Even if it's FDA approved, the insurance company will approve TMS only after a failure of 4 antidepressants and 1 or 2 courses of psychotherapy. However, TMS is effective. Earlier on, the studies are not there yet, but earlier on, in my mind, there's no doubt that if it's helping a patient population who's treatment resistant, that it's going to have really remarkable effectiveness. And the challenge is to get the word out to people. Where are you in your spectrum of depression? Especially for an entrepreneur who's busy, has the weight of a company, keeping the lights on and keeping, paychecks rolling for all their employees, dealing with all the stresses, making all the hard calls, all the hard decisions every day. And on top of that, you're suffering from, anything on the continuum from starting to lose your edge, to getting burnt out, to actually starting to have mild or moderate depression. What's the cost to you and your business of not taking action sooner with a modality that is effective, safe, and doesn't have the side effect burden of antidepressants?